Hello, good afternoon. So today I'm going to perform an assessment on the hair, skin, and nails. But before that, we need to perform proper hand hygiene and put on a PPE if necessary. And if we are done with that, let's proceed with the assessment. So good day, sir. I am Jean Lopez, your student nurse for today's assessment. So can I get your name, sir?
My name is Emmanuel Lopez Kumar.
And your birth date, sir?
My birthday was September 14, 2006.
So that is the first thing to do, to identify your patient, and after that, we need to explain the procedure. So I am going to perform you an assessment on your skin, hair, and nails. We do this to ensure that everything is normal and there are no abnormalities, problems, and any discoloration. So the first part of the assessment is inspection. So we need to inspect the overall skin coloration of our patient. Sir, may I ask you to raise your arms 90 degrees like this? So what I am looking here is I am looking for any signs of tumors, cyanosis, and jaundice, which can indicate abnormalities in the skin. So my patient's skin color ranges from light brown to deep brown, which is normal. So the next thing to inspect is to look for these skin lesions. So sir, may I ask you to raise your arms again? So we are trying to look for any signs of bruises, insect bite, or scratches. So as I am inspecting my client's arms, there is no skin lesions, which indicates that there is no abnormalities. So let's proceed with the second part of the assessment, which is palpation. So we're going to palpate the skin temperature of my patient. So we are going to palpate the skin temperature of my patient using the back of my hand because it is sensitive with temperature. So let me check. So we are trying to feel for any signs of fever or infections. So, but it looks like my patient doesn't have a high temperature or neither low. It seems that my patient have a normal skin temperature. So the next thing we need to palpate is the texture and moisture. So for assessing the texture and skin turgor of the patient, we need to expose the skin just below the clavicle. So in assessing the skin turgor, just pinch the skin in the clavicle. And if the skin returns immediately, it means that there is an absence of skin turgor. And if the skin remains as pinched as it is, there is a presence of skin turgor, which means there is a dehydration. So lastly, we want to palpate for edema. So can I ask you, sir, to raise your foot? So in assessing for edema, we want to put or apply pressure on the skin. If the skin become inverted, it means that there is a sign of edema. Daddy wants to. But if the skin quickly returns to normal, it means that there is no signs of edema. So it seems like my patient doesn't have edema. So, and now we are done with assessing the skin. So let's proceed with the assessment of the nails. Can you please raise your hand like this, sir? So what I am trying to inspect here is the shape, the color, and the texture, and see if there is any signs of bullseye. So as I can see, as I'm inspecting, the nails of my patients are normal and no signs of abnormalities and deformities. So the next thing we want to assess here or palpate is the capillary refill and the texture of the nails of our patient. So in doing this, we need to put pressure on the nails. So if the color quickly returns normal, that means that there is no abnormalities or deformities. And if it doesn't quickly return to normal, there is a sign of abnormalities. So the next thing we're going to assess is the hair and scalp of our patient. But before doing that, we need to put on our gloves. So let's proceed. So what we are trying to see here is any signs of lesions, infestation in the scalp and hair of the patient. If there are any lice in the hair, we need to take note for that. So as I am inspecting my patient's hair and scalp, it seems that it is normal.